Hi friends, welcome to Plexus Ortho. My name is Dr. Kannan Kumar and I'm an orthopedic consultant at Plexus Ortho. Today we're going to discuss one of the MCQs that we put up a couple of days ago in the Telegram channel. It was MCQ number 247. The MCQ was, which of the following tendons is predominantly involved in patients having pain in the elbow following resisted wrist extension? So what is the meaning of having pain when doing resisted wrist extension? It is the Cosens test. What is the test called? Cosens test. And in which condition is it positive? It is positive in tennis elbow or lateral epicondylitis. Tennis elbow or lateral epicondylitis. So resisted extension is very clear. So it is an extensor group of muscles that are affected. So which extensor muscle is affected predominantly in tennis elbow? It's a very factual question. All of you should know this. It is ECRB. So you can use the elimination method, and we know that these two are flexor tendons, so these two are not the answers. And then you have the two extensor tendons. One of them should be the answer. So they always mark an answer when you're having two possibilities. When you've eliminated the other two possibilities, always mark one answer in these two answers. So extensor carpi radialis brevis is the answer. Extensor carpi radialis brevis is the one which is affected in cases of tennis elbow or lateral epicondylitis. So let's go in a little bit more detail about tennis elbow. Tennis elbow is a very common condition in any OPD, ortho OPD. You would see dozens of these cases every day. So basically it is an affection of the extensor origin from the lateral epicondyle. So these muscles here are affected when they originate from the lateral epicondyle. It's a very debilitating condition for the patient, but the muscle that is affected is called as a ECRB, and it's called the extensor carpi radialis brevis. So what kind of pathology is seen? It is not exactly inflammation. Pathological studies have shown it to be, it's called as angiofibrotic dysplasia. This question has been asked before in your exams. What kind of pathology is seen in tennis elbow? The pathology seen is called as angiofibrotic dysplasia. Some kind of new vessel or new blood vessel formation is seen. Angiogenesis is seen in the ECRB tendon underneath the tendon, right? So ECRB is the most commonly affected among the extensor tendon group of muscles in lateral epicondylitis or tennis elbow, and the pathology is angiofibrotic dysplasia. What are the tests that you do for checking the tennis elbow or finding out whether the patient has tennis elbow? The first test that you do is called as the Cosens test. So you ask the patient to extend the wrist against resistance of the examiner, and if the patient has pain in the lateral epicondyle or extensor origin region or the lateral side of the elbow, this indicates that the patient is having tennis elbow. So this test is called Cosens test. The next test that is done is called as a Mills test. Mills test is where the patient is asked to extend the elbow completely and with the opposite hand to press and palmar flex the wrist. If the pain is produced at the level of the lateral epicondyle or lateral side of the elbow, this indicates positive Mills test and the presence of tennis elbow or lateral epicondylitis. The third test that can be done to check for tennis elbow is called the Maudsley's test, where the patient performs resisted extension of the middle finger, and this produces pain again in the lateral epicondyle and the lateral part of the elbow, indicating lateral epicondylitis or tennis elbow. Okay, so how do you manage these tennis elbow conditions? So tennis elbow is basically initially managed by RICE. What is RICE? R is for rest, I is for icing, C is for cold compresses, and E is for elevation, right? So the RICE therapy that is done for other inflammatory conditions can be done in tennis elbow as well. So adequate rest must be given. Avoiding repetitive wrist extension movement, including the riding of two-wheeler, which will cause increase in wrist extension movement, should be avoided. Ice or hot compresses can be used 2 to 3 times a day, and with some kind of gentle massage or ultrasound or physical therapy methods can be used. You can also use a tennis elbow brace or a counter brace. This is called a tennis elbow splint, or it can also be called as a counter brace in your exams. Don't forget, it is the same term. It is worn slightly below the level of the lateral epicondyle, and when the patient does wrist extension, it will protect against excessive action in the lateral epicondyle and therefore may decrease the pain. So this is called as a counter force brace, and this is also called as a tennis elbow splint. So they both are the same terms, they mean the same thing, so don't get confused in the exam. So also we can teach them to do resistance exercises, physical therapy methods, ultrasound can be done to reduce the pain with lateral epicondylitis. One thing you must understand about tennis elbow is it is a self-limiting disorder. It usually gets better with time. Most patients get better with time. However, the time differs from patient to patient. It can be anywhere from 1 to 6 months in time duration. So therefore, it's a self-limiting disorder. Remember, tennis elbow, plantar fasciitis are self-limiting disorders. You can also use what is called as PRP. All of you know the definition or the full form of PRP. PRP is platelet-rich plasma. So you take the patient's own blood, centrifuge it, and take the plasma which is rich in platelet and inject into the lateral epicondyle. This is shown to contain stem cells and therefore stimulate or decrease inflammation and stimulate normal healing process of the damaged tissue, and therefore decreases the pain. Can also give a steroid injection. Usually we give what is called as a triamcinolone injection, which is a low dose steroid injection given in the local area, and this also reduces the inflammation theoretically and improves the healing process. If all fails, more than 98% of patients can be managed conservatively. If all else fails, then we can do surgery. Surgical release of the ECRB can be done both arthroscopically and can be done in the open means, will immediately reduce the pain for the patient. So, but remember, it's a self-limiting disorder. More than 98% of patients do not require any kind of surgical intervention. So what is a counterpart of the tennis elbow? Counterpart of tennis elbow is called as golfer's elbow. We know that the golfer's elbow occurs on the medial side of the elbow joint. Main tendon that is involved is the FCR. What is the main tendon involved in the lateral epicondylitis? It's ECRB. In the medial side, where the medial epicondyle is affected, where the flexor pronator mass originates, the main tendon that is affected is the flexor carpi radialis. So the resisted flexion of the wrist will show up symptoms in the medial epicondylar region, and this indicates golfer's elbow. The treatment for golfer's elbow are similar. Of course, golfer's elbow is much less common than the tennis elbow that we see very commonly in our clinics. Golfer's elbow is treated in a similar way. It's a self-limiting disorder. You can use counter brace, you can use resistive exercises, you can use a RICE therapy, that is rest, icing, hot compresses, and elevation of the limb can be done. Brief discussion about tennis elbow. It's very frequently asked question every other year, right? So the tendon most commonly involved is the ECRB. Extensor group of muscles are involved usually, and in that ECRB is the most common involved. The pathology is angiofibrosis, fibrotic dysplasia. It is not exactly inflammation, but it is angiofibrotic dysplasia. This question has been asked before. Cosens test, Mills test, and Maudsley's test. These are the three tests used for the diagnosis of tennis elbow, right? And the treatment is usually, it is a self-limiting disorder. You use rest, you use counter brace, and only in very rare occasions you will need surgery for this condition. So that is a brief and overview about tennis elbow and the question, MCQ question that we had asked a couple of days ago. And thank you for hearing me out. My name is Dr. Kanan Kumar, and this is Plexus Ortho.